So the nice thing about testosterone is when a man takes testosterone, it turns into two things. It turns into dihydrotestosterone and turns into estradiol. And what it does is it helps to prevent heart attacks, prevent strokes, prevent Alzheimer's. It helps to push back type 2 diabetes. So if there's men out there that have a history of cardiac disease in their family, they have a history of heart attacks, of strokes in their family, they have a history of type 2 diabetes. When you're in your 50s, that's when we start thinking about mortality. You know, when we're in our 20s, we don't think much about dying. We don't think much about our health because we normally have it. And so as we get older, we start thinking about mortality. We start thinking about getting in shape. We start thinking about prevention and disease prevention. And I tell my patients, if you have a history of heart attacks, if you have a family history of strokes, of Alzheimer's, of diabetes, of autoimmune disease, of hypothyroid, you need to get on hormones. Really, every man over 45 needs to get their testosterone levels checked because you will benefit from testosterone. No, we're not trying to turn you into a bodybuilder, into an Arnold. What we're trying to do is bring your levels back to the normal level where they used to be in your 20s and 30s. And at that point, that's going to help you live much better and live more healthy over the next years. The interesting thing, if you would ask men walking by on a street, where in your body do you have the most testosterone receptors? You probably would get a number of different replies. But the interesting thing is you have the most testosterone receptors in your heart. So think about that. You have a number of, your heart's beating every day, hundreds of thousands of beats a minute. And we all know men who are older, in their 80s and 90s. They're frail, their shoulders are rounded. They're not with their shoulders pushed back. They don't seem as though they're as strong as they used to. They're frail. And think about if their testosterone levels were elevated to the point of where they used to be back in the day. They probably would be stronger. They would live a healthier life. They would be able to be more resistant to disease and to infections.